All right, parents, here we go again. It's the Ask Dr. Tony episode. This is the Experience Miracles podcast, and I'm your host, Dr. Tony Ebel, an expert in pediatrics, neurodevelopmental disorders, and drug-free, nervous system-focused healthcare. On this weekly episode, I'll be addressing the top questions on every parent's mind. If there's one thing we love and welcome, it's parents who never stop learning, asking the hard questions, and advocating for your kiddos like none other. So get ready for some real talk, real-life clinical and parenting experience, and real easy to understand answers that will help your family take action and get to that next level of health and healing. You ask, I answer. Let's dive into today's episode. If you're a parent of a child with autism or other neurosensory challenges, you've probably noticed them engaging in these repetitive movements like hand flapping, rocking, teeth grinding, making certain sounds, things known as stimming. That's what these behaviors often leave parents wondering, what is this? Is it harmful? Should I try and stop it? What does it mean? What's its root cause? In this video, we're going to explore the real root causes of stimming and get into the neurological dysfunction that really explains why they're happening in the first place, because that's where the connection to relief comes from. Understanding nervous system dysfunction, dysregulation, and what's really going on, as we like to kind of say, under the hood with your child's body. That was the case for our little rock star patient, Amelia, a young girl who came to our office with these repetitive nodding movements. Her mom noticed these tics, these stims would appear anytime that Amelia felt stressed or anxious, and she was saying, I'm just trying to get rid of the butterflies in my stomach. The traditional medical approach suggested, hey, it's got to be due to blocked adenoids. But even after surgery, the signs and stims persisted and worsened. When medications were suggested as the next step, her mom's gut intuition and instinct said there has to be another way. Through our deep dive consult and our neurological scanning technology, which we'll talk about in this video, we discovered what all the other doctors had missed. Amelia's nervous system was stuck in this perpetual state of sympathetic overdrive, stress, sensory dysfunction, and it was creating these movements, these tics or stems, as a way to self-regulate. And that's the real science behind stimming. That's a natural, regular, normal response to an absolutely dysregulated, off-track neurosensory system within your child's brain and body. So when the environment, when the world gets really busy, really noisy, really chaotic on the outside, because their nervous system is already what's called subluxated and dysregulated, two terms I'll break down next, on the inside, 80% of children with autism will regulate and self-soothe through these stems, through these different sensory movements and responses, because they struggle already to regulate their nervous system on the inside. So when their nervous system is asked to regulate, calm, and do these things even more when it gets busy with sensory input from the outside, they struggle to do so. And that's where the hand flapping, the teeth grinding, the vocal tics come from. There is a real neurological cause, an explanation as to why stimming is happening. And once we can know that root cause and what that neurological dysfunction and dysregulation is, then we can address it naturally, neurologically, and without drugs. And so many families find relief and such improvements in quality of life, because once we can get your child's nervous system more calmed, more regulated naturally, neurologically on its own, it doesn't need to rely on stims and responses so much more going forward. So let's break down the science just a touch more so you really know what's going on with stimming and with this nervous system dysfunction. That's actually the root cause underneath and behind it all. Okay, now that we know that these movements serve as a coping response to an overwhelmed, stuck, sensory, sympathetic, overdrive, dominant nervous system, let's take a look at what the nervous system really does and how it's supposed to function. The nervous system, from kind of a 30,000-foot view, has two branches to it. It has this sympathetic fight or flight response we've already been talking about, and that's the I'm stressed, I'm anxious, I got to get out of here response. But then it has the other side of the autonomic or central nervous system called the parasympathetic response, which is our rest, relax, digest, and sensory regulate side of the nervous system. There's a nerve within that second calming regulating side of the nervous system called the vagus nerve, which does a lot of this function for our child's brain, body, and nervous system. The calming regulating nerve is called the vagus nerve, V-A-G-U-S, which is always funny knowing that it's the calming relaxing nerve, since Las Vegas, if you've ever been, is not the most calming and relaxing city to ever attend. So I always sneak that in so people can kind of understand. This kind of vagus is totally chill. And what we know is that children struggling with autism, sensory challenges, ADHD, you name it, if tics and stems are involved, we already know that foundationally their nervous system is out of balance. It is at a state of what we call dysregulation or dysautonomia, where the sympathetic fight or flight response is too much and the parasympathetic vagal nerve response is too little. Now, there's one more word we need to introduce to really explain where this nervous system imbalance and dysregulation comes from, and then very specifically the neurophysical, neurosensory components that cause stimming. And that word is something called subluxation. Now, subluxation is a word you've maybe never heard before. It's a very neurologically focused chiropractic term. And subluxation simply means that first, it shifts the nervous system into that sympathetic dominant state we've been talking about. But subluxation has these neurophysical, we're going to call them components. Subluxation is joint dysfunction. So there's misalignment, and then there's fixation or reduced movement. Now, that conversation opens up the very final, I promise, nerdy term for this video called proprioception. Now, if your child has autism, has sensory issues, you've probably gone to PT, OT speech, and maybe you've already heard about proprioception, altered motor tone, there's hypertonicity, and then there's weak core or hypotonicity, and these sensory issues. You maybe heard of these terms before: proprioception, mechanoreception. Proprioception is the perception of movement. When we are moving, these proprioceptors, mechanoreceptors, send actually a calming and regulating signal through the spinal cord, brainstem, especially the vagus nerve has a lot to do with this, and into the brain. Now, movement is calming. Have you ever had a really busy day at work, just stuck at your desk, stuck in traffic, stuck on a plane, and it was really noisy and chaotic and busy and stressful? And so your brain and nervous system are bringing in a lot of stress and a lot of noise, but you couldn't move. You couldn't get up and dissipate and get rid of that stuck stress. Have you ever noticed that throughout the day, the longer you get stuck in one position, your neck, your shoulders, and your spine start to tighten up? And then when you have that physical sensory subluxation, decreased proprioception action happening within your brain, how's your mood? How's your emotions? How's your behavior? How's your focus? How's your socialization and emotional regulation? So this concept of subluxation, decreasing proprioception, is exactly why so many kiddos with autism and neurological conditions rely on stimming so much. They literally have stuck joints and stuck segments within their neurospinal system, specifically the neck and the brainstem area, number one, their shoulders and thoracics, number two, or what are called the transition zones of their body, and then their lumbopelvic core as three. So because they're not getting this proprioceptive, calming, regulating, make the brain chill out movement from their neurospinal system, because that's responsible for 60% of all this input into the brain, they have to compensate somewhere else, somehow else. So the hands, the feet, the jaw, and a lot of times the crotch are very sensory rich or proprioceptive dense areas. So when kiddos have subluxation and nervous system dysregulation within their spine and nervous system, they will compensate with their jaw, vocal tics, teeth grinding, with their hands, touching, hand flapping, with their feet, toe walking, and so forth. And it's a sign of subluxation more deep, or we would call more central, within their brain-body connection and nervous system. So that's the deep dive neuroscience behind stimming. Now, before we're done, I want to turn the corner and I want to give you 3 different ways, safe, natural, neurological, drug-free ways that neurologically focused chiropractic care. So a very specialized kind of chiropractic care that we specialize in our office and through the PX Docs network. There's 3 ways that this kind of chiropractic care can really help calm this dysregulation and sensory overdrive and stimming sort of challenges in kiddos who are going through that kind of storm. The first way we can really help out improve quality of life for kiddos struggling with these challenges is we can clean up and calm down the sensory input into the brain and nervous system. Subluxation wreaks havoc on sensory motor input into the brain. It leads to too much tension, so that sympathetic dominance, and it interferes with vagal nerve function, which is the calming, regulating side. So cleaning up that subluxation allows for a more clean, calm, regulated, balanced response within the autonomic and central nervous system. And second, we already mentioned it, the vagus nerve. The vagus nerve is the calming, regulating, relaxing side of the brain and nervous system. And so our specific adjusting protocols are designed to stimulate and activate the vagus nerve. And this kind of chiropractic very much taps into that calming, regulating, relaxing side of neurological function. And when we get the vagus nerve going once again, we can calm the brain-body connection, and a child doesn't need to seek out so much of this calming, regulating, compensatory function on their own. And number three, because the vagus nerve really is highly involved in sensory, emotional, behavioral regulation, parents report all the time that their kiddo, once they're getting adjusted with this specialized kind of chiropractic, just handles their environment better. They handle transitions better. They handle noises better. They handle sensory input and touch and close and all these different things better. They report that they sleep better. Their gut function is improved. And so when this kind of chiropractic care gets the nervous system more balanced, more regulated, and in a better state, then the body is more relaxed. Digestion is more effective and less troublesome. Everything calms, relaxes, and regulates with this kind of chiropractic care so that a sensory, stemming autism child has less of the expressions of this neurological storm and dysfunction and dysregulation. Because as you lessen that and clear that out on the inside, so in chiropractic we kind of call it from the inside out, then they can handle what's going on the outside with their environment so much better, and they don't need to resort as often, as much, or often as severely to these responses like stemming and meltdowns and tantrums and so forth. Now, does that mean that chiropractic care is designed to treat or heal these stems or neurological challenges? No. Everything with our care, as you can pick up from this video, is designed to address the root cause: nervous system dysfunction, dysregulation, subluxation, and dysautonomia. Kiddos who are locked into autism and have significant stemming sort of behaviors, that tension, that subluxation is often locked in there many layers deep. So what we do is we sit down knee to knee with parents and we go into our case history. We find all the time that kiddos who are stemming and locked into autism, they were already locked in neurologically from a high-stress pregnancy, birth interventions like forceps, vacuum, and C-section that caused that injury to the neck and to the neurosensory system. They were colicky, they were fussy, maybe they had torticollis, plagiocephaly, difficulty nursing, reflux, chronic ear infections, chronic gut issues. They don't sleep, their digestion is a mess. So through the case history, and then through what's called our neurological insight scan technology, we can actually measure this, track this, and find, through this incredible technology, we can actually find, measure, and locate subluxation, dysregulation within your child's sensory system. So between the case history deep dive and our incredible examination and technology, we know exactly what we are up against with your child's nervous system. And then we sit down knee to knee and we go through a very specific, customized care plan and adjusting protocol plan for your kiddo. The first step for you to take, if this video sounds like to the T, your kiddo, and you've tried everything to calm their sensory system and address these stems and these daily life struggles that I know are really, really tough to go through here, there, and everywhere with your kiddo, take the first step to learn more. And if you're ready to get that deep dive consult, exam, and scanning technology, comment below and we will get you more resources and connected to either our office if you're local or to another PX Doc's office if you're not. Learn more and take that next step to find out if subluxation, nervous system dysregulation, and the challenges we talked about and got pretty nerdy about on this video are what's really causing your child's stems. Thank you for tuning in to today's episode. Do you have a question that you would like to submit? Either send it to support@pxdocs.com with the subject Ask Dr. Tony, or head on over to our socials at PX Talks, where you can submit your question in our stories every single week. Every kid counts and every family counts, so let's leave no questions left unanswered. If you loved this episode and you want to help us reach more kids, we would so appreciate if you left a review and a rating on your favorite platform. God bless. Be well. We'll see you on the next one.